In week 1 of Health, Society and Research, I learnt about health and illness, specifically the nuances in society's definition of this topic. Through the readings, lecture and tutorial this week, I was introduced to a multitude of different perspectives. What was most eye-opening about this week was the sheer differences in perspectives on health others would have compared to my own. For example, one of the readings based on elderly populations this week identified this group of people having a heavier emphasis on holistic well-being and maintaining independence whilst performing their own activities. This was vastly different from the video depicted of same-sex couple Manny and Ken in the tutorial this week. This video emphasized their interests in maintaining political and cultural advocacy surrounding health. These two definitions of health differed from my own personal perspective, which was borrowed from the definition of health from the World Health Organization and defining it as a state of physical, mental, and social well-being whilst upholding a disease-free and illness-free outlook. From the lecture and discussion with my CBL group this week, though, it became glaringly evident that this definition was far too basic, as health, in the eyes of a public health professional, must further consider the values of each individual they treat and the many determinants of good health, such as cultural identity and health literacy. These learning opportunities helped reevaluate my own knowledge on the current role of health professionals, which is now to provide a patient-centered care by catering to the patient's definition of health. The difference in health perspectives has also made me aware of my own biases, such as possibly presuming an elderly patient, as mentioned before, wanting a multitude of support networks like I would want. However, they may instead prefer a treatment that enables their own autonomy and independence instead. Whether my biases are inherent or not, this week has exemplified the importance of building rapport with patients as a future healthcare professional to provide the best patient-centered care. This is achieved through minimizing my own biases and understanding that the definition of health is dynamic. If I were to propose a research question out of this week, I would love to ask healthcare professionals, what do you think specific groups of people find most important about their health? By gathering their understanding about health of certain groups of people and then comparing the health values of these respective people, it would help identify whether or not biases of health professionals align with the communities they treat and if they are beneficial to their overall care. Thank you.